Programs for TB, malaria and HIV prevention and treatment in Kenya would not have been possible without the leadership and support provided by the Kenya Coordinating Mechanism, KCM, for the Global Fund and its Secretariat. KCM is a multi-sectoral mechanism charged with the governance of the Global Fund supported HIV, TB and malaria programs in Kenya.
The Kenya Country Coordinating Mechanism was first established in the year 2002 with a key mandate of coordinating the development and submission of proposals for funding to the Global Fund to fight the key devastating diseases of HIV/AIDS, TB and malaria.
In discharging its mandate, the Kenya Coordinating Mechanism is supported by the KCM Secretariat.
The work of the Secretariat. This is really the nerve center of the KCM work in Kenya. This is where all the meetings are planned, whether they are scheduled meetings or they're special meetings. This is where all the minutes are done in a very organized, professional manner. And I can say with a lot of satisfaction that we receive these minutes very well in advance so that we can prepare ourselves in the business of the day. And any issues that we are supposed to raise, we raise that in advance of the meetings so that we don't take too long stuck on a particular item.
The Kenya Coordinating Mechanism provides the overall leadership in the mobilization and coordination of the Global Fund grants in Kenya.
The mandate of KCM is to coordinate the development and submission of funding requests to the Global Fund and approve any programming of Global Fund grants. Also to nominate principal recipients responsible for implementation of Global Fund grants and to oversight the principal recipients and sub-recipients in the implementation of the grants. To re-engineer itself, KCM undertook several diagnostic assessments that resulted to the renaming of the Kenya CCM to Kenya Coordinating Mechanism, a lean inclusive membership of 18 members and their alternates, and a revamped governance structure.
Over the years, the Kenya Coordinating Mechanism has achieved a lot. KCM prides itself with an enhanced governance structure which is facilitating the entity in discharging its mandate both efficiently and effectively. In between the year 2002 to April 2015, Global Fund has committed $896,928,323 to support HIV/AIDS, TB and malaria programs in Kenya. The commitment to support HIV was the highest at 60%, with a grant totaling to $541,607,793. Tuberculosis was $68,127,216, standing at 8%, while malaria amounted to $287,193,314, that is 32%. With the approval of the TB/HIV concept note in May 2015, which is now at the grant-making stage, Global Fund's total commitment from the year 2002 to date has risen to $1,146,572,880. With the support of the Global Fund, the government of Kenya and its stakeholders have over time achieved significant results. According to NASCOP, by March 2015, about 50% of the 1.6 million people living with HIV, that is 787,817 Kenyans, were on ARV treatment. The bulk of those on treatment are supported by the Global Fund. Total new HIV infections are estimated to have declined by 15% from 116,000 in the year 2009 to an average of about 98,000 in the year 2013. 11.3 million insecticide-treated mosquito nets have been distributed to intensify malaria prevention. Over 15,000 cases of new smear-positive tuberculosis cases are detected and treated per year. Kenya was recently categorized as a low-middle-income country.
This year, according to the World Bank's classification, Kenya has been placed at the level of lower middle income economy. Based on that, is a global fund policy that once you attain that level, you start contributing more to your grants. So as a country, you're supposed to contribute 20% of what the global fund is disbursed to the country. Happily, this coming financial year, starting from 1st of July, you'll be having 2.6 billion Kenyan shillings to support the country programs for HIV, TB, and malaria.
Global and national statistics denote that young men and women are more vulnerable to new TB and HIV infections. The youth and women are also primary caregivers at community and household level. This underscores their representation and participation within the KCM. The Kenya AIDS Strategic Framework identifies key populations as primary drivers of new HIV infections. Sex workers have been identified to have the highest prevalence rate of 29.3%, followed by people who inject drugs with a prevalence rate of 18.3%, and men who have sex with men with a prevalence rate of 18.2%. It's against this background that key populations are represented at KCM level to inform programming and designing of the national concept note on trends, issues and challenges they face, especially with respect to access to health services. The collaboration between health facilities under the national and county governments and civil society organizations working as either principal or sub-recipients is gradually yielding positive results.
We started working with KCCB as a CSO, which is supported by AMREF, and the funds are from Global Fund. The impact that we have seen, our case notification from 2012 has, from 2012 we can give a comparison. We had 341 case notification as per 100,000 persons. To date, the case notification is going down, as we can see the trend. The trend in 2013, it went down to 302 as per 100,000 persons, and 2014 still going down. We have reported case notification of 274 as per 100,000, meaning that our case notification on the ground, the impact of the community can be felt, and that's why we are not getting more TB patients. Our treatment success rate and cure rate, we started working with the KCCB as a CSO around 2012. Our treatment success rate was at 85%, but if I can share with you today, treatment success rate is at 89%. Before we had KCCB on board supporting our community healthcare workers, our loss to follow-up was at 7%. But so far we have gone down, and we are now ranging at 2%, which is a plus for us with the support of KCCB, meaning that the funding that is coming on the ground is really having a lot of impact on the people that are receiving it, who are doing defaulter tracing and contact.
The investment made by the Global Fund, the government of Kenya and all stakeholders involved in coordination, management and grant implementation is yielding positive results and creating hope. Global Fund's support in the fight against tuberculosis is bearing fruit. Mothers, children, the youth and families are getting cured of TB and generating optimism across communities and the Kenyan population. Communities like that of the Maasai in Kenya are also changing and adopting healthier lifestyles through the work of TB ambassadors like Timpian.
I suffered TB of the intestine in 2011, and I was told I got it from taking milk that was not boiled, meat that is not well cooked, or even just blood, and normally that's our basic food as Maasais. We are nomadic people, we move from one place to the other, so getting even health services for us is a problem. And because of that, I decided I'm going to start creating awareness about tuberculosis, just to tell our Maasai people that TB is there, but it's curable at the end of the day. That if you take medicine according to the doctor's instruction, you will be well and you'll get back to your business. By creating awareness, we talk to them about their houses, because our Maasai houses don't have windows. They have small, very small, tiny holes. And because of that, we told them about the importance of airflow in their houses and just light getting into the house. Because when you have airflow, even if I'm in there and I'm coughing, at least my bacilla, the TB bacteria, will be blown away by the wind. But if we don't have windows like these ones, we have the small holes, then all of us in that household, at the end of the day, 2 or 3 of us will have TB. I appreciate Global Fund because of it, we get free medication and we get access to medicine. Because you can imagine taking medication for 6 months and you're told to pay. Truly, I think that would be very expensive for us. But because of what Global Fund is doing, we are able to get free medication, diagnostic sites, you go, you are tested, your sputum is free, and we thank God for that. Due to what I do, now I'm selected to be in the KCM Kenya, whereby we sit down and shape activities in Kenya.
New institutions and champions have come up to ensure that HIV, TB co-infection and malaria, which pose a great threat to HIV persons with suppressed immunities, is effectively being managed.
I was infected in 1996. That's when I knew my HIV status. And since that time, in 2004, I got my first TB. And when I got TB, I got medication for 8 months. In 2007, also I got a TB relapse, which I had to go through injection, which were 56 injections in total. Last year, I also got another relapse, which I went through and I've finished the medication. Through NEFAC, we've been advocating and going to visit the community, reaching out to those who are suffering from TB, those who are suffering from HIV, because TB and HIV is most connected. Malaria also, we also get some nets which help us in covering us from getting malaria, which can accelerate the HIV issue. The AMREF is giving us some funding from Global Fund. Also, Red Cross is also giving us some funding from Global Fund, and we are reaching a larger community. TB has got a lot of challenges, and I thank Global Fund for coming in our aid to help us, because HIV does not kill, but TB kills. HIV will just contribute to the TB menace, and TB will not waste time with anybody. But Global Fund has been very much handy, and it has helped very many people.
A new dawn is emerging. A HIV-free generation is in the making, as evidenced by the life and powerful experiences of Celestine Musyoka.
I'm HIV positive for the last 16 years. I first learned my HIV positive in 1998 when I had so many opportunistic infections and I was admitted to the hospital. And at the hospital, I just saw my file written HIV positive, and that is how I knew I had HIV. And after discharge, I just went home for the next 6 months. There was no counseling, no care, and from then I got pregnant at some point. And when I got pregnant, the opportunistic infections were back again, and they were even more serious. So in the process, my mom was referred to a VCT center by a friend, and from the VCT center I went, and I didn't tell them that I knew my HIV status. So they did counseling and testing again, although I didn't disclose that I was 5 months pregnant. And then when I went out, I came back and I shared with the counselor that I was expecting, and I didn't want my mom to know because I was afraid of a reaction. So when we went back again, we did the counseling again, and she referred me to a program in Kibera, and that is how I got involved in PMTCT. It was a little bit difficult for me to go with the baby, so my mom took him to Pumwani Hospital. Then from there, because I thought I got HIV infection due to not having information, and I'd joined support group in Kibera, I thought the information that I got would be useful to young people like me, and I was involved in a lot of peer education in schools, universities, and in the community. And then at some point I trained as an HTC counselor. In 2007, I think my life was now a little bit new because I got married to an HIV positive person. I also didn't want to infect another person. And then from then in 2010, I got pregnant again, and I gave birth to a baby girl. And this time around it was a bit different, because now there was a community health worker who would follow me on how I was doing. She would ask if I went for my antenatal clinics, if I was taking drugs, and then there was counseling. Initially when I got baby Frederick, I was not allowed to touch him because my family was afraid that I would even infect him. But with baby Maggie, now I brought up, and I did breastfeeding for 6 months. And after 2 years, I was even comfortable to take her for testing. I wasn't afraid. I knew that the right thing had happened. So she was tested, and she tested negative. I'm grateful to KCM for mobilizing the resources, and to Global Fund for making the resources available. I am on free care and treatment, and I have now HIV-free family.
KCM's all-inclusive and collaborative approach and the impetus to transform itself provided by the new funding model has thus paid dividends for Kenya. Today, KCM is a stronger and a more efficient entity that discharges its mandate of mobilizing resources to support the fight against HIV/AIDS, TB and malaria for non-state actors and the government of Kenya. In addition, KCM is effectively oversighting grant implementation to ensure that children, the youth, adults, remote and hard-to-reach key populations all access critical health services. KCM's oversight